today with us. I'm Nathalie Jean-Baptiste. I'm head of programs at the Julius Baer Foundation, and I warmly welcome you to our series Equality Talks, and this is an Africa edition. This month is a special month for the Wealth Inequality Initiative because it celebrates its third anniversary. Yes, you heard it right, third anniversary. And today we will have the first presentation of a series of 3 talks with change makers who are really contributing to empowering communities in Africa. We will discuss 3 main issues: equality and health today, equality and education, and equality and women empowerment and sustainable housing. These issues are not randomly selected, As you know, the Julius Baer Foundation is committed to reducing wealth inequality. And there are many negative implications of not addressing the gap between those who hold power and resources and the many who do not have enough. So many of you already know there are economic implications. Wealth inequality has also negative impact on state capacities. Wealth inequality also reduces the resilience of households to absorb sudden shocks, and many of you have seen this during the COVID pandemic. So health is the question that we will be discussing today. And health inequality is unfair and avoidable. And this is why I have the pleasure of having our first guest, Jimmy Harare, who is Associate Community Health Director at Partners in Health, which is also known as APSU. How are you, Jimmy? Welcome to our Equality Talks. I'm really happy to have you here today.
Hello, Nathalie. I'm fine, thanks.
Wonderful. For those of you joining us online, please note that you have the opportunity to send your questions on the chat. So APSU is the sister organization of Partners in Health and operates in Malawi. The HIV epidemic is still present in Malawi, especially in rural areas. And this is where APSU comes to support the local government, providing better health care across Malawi. The Julius Baer Foundation and APSU have joined projects and have joined force. And the project is called Aspire. It began a few years back in 2021. And this project is now generously co-funded by the Leopold Bachmann Foundation. I do not want to say more. And let me just give the space to Jimmy. Jimmy, please tell us more about your organization and how you operate in Malawi, please. The floor is yours.
Okay, thank you so much, Nathalie. As Partners in Health, we are a social justice and pro-health organization with a mission of creating and providing preferential option for the poor in healthcare delivery. And we accompany the Minister of Health in providing essential health services. And this is done through, ensuring that we support human resources for health. We are also ensuring the provision of essential health infrastructure. We are also ensuring the provision of essential medicines and supplies, but also strengthening health systems to improve healthcare service delivery. And finally, also providing social support to our clients and patients. As an organization, we started operating in Malawi in 2007. And our core focus is on ensuring the quality care and ensuring that we build also the systems that are sustainable. And in our cooperation, like I mentioned, that we started operating in Malawi in 2007. We started in Ineno, where we are serving a population of over 160,000 through the networks of health facilities. But apart from Uneno, we are also across other districts in the country where we have several programs supporting the Ministry of Health, and one of the programs being the NCD program where we are in all the districts in the country. Apart from that, we are also supporting other programs like emergency response, but also supporting the Ministry of Health in implementation of the Health Sector Strategic Plan 3. Just to give you a background, a little background of context, you may wish to know that Malawi is one of the least developed countries, ranked at 174 out of 189 UN developing countries, developing country index. And you might also wish to know that over 50% of half of the population of the people in Malawi live in multidimensional poverty, which is including the economic, education, and also infrastructure. In terms of HIV, prevalence is also still high. It's estimated at 8.9%. And you might also wish to know that a growing proportion of the Malawi's population that is living with HIV is adolescents and youth. So you might know that this also has a negative impact on the adolescents themselves. And apart from HIV, you might wish to know that there are also other sexual reproductive health issues that also affect the girls and young women. And this also includes teenage pregnancies, early marriages, and also even the complication, obstetric complications. So all this also has an impact on adolescents.
Jimmy, I began to say that health and wealth inequality are connected. And I know your work and the work you do in Malawi is to address also questions of wealth inequality. Can you explain from your perspective and based on the issues you see, how this connection happens?
I think because of the gaps that are there, we'll see that one, this also has a negative impact on the health and HIV specifically. You could say that from our experience that we've seen that this is also creating decrease in the HIV testing, and also even a decrease in terms of the HIV prevalence knowledge and information. There is also a high risk of HIV infection, but also a risk of general HIV prevalence. So there is that relationship that also we've observed or we've seen.
Very interesting, Jimmy. Very interesting, Jimmy. And this is where the project Aspire comes into play. And I'd love you to give the audience a sense of what that project is, and also perhaps what is your motivation to do the work you do in the district of Nino.
Thank you, Natari. I think the first thing is that as an organization, PIH, we understand that there are several social determinants of ill health. And if we are to promote quality or access to quality health care, we need to address all these underlying issues. We need to address issues of social, the economic vulnerabilities. We need to address issues of gender inequality. We need to address issues of education, supporting education, because we know as far as education is concerned, this is also another factor that needs to be considered in terms of bridging the wealth inequalities. So these are some of the things that motivate us. But we know as an organization that we can't do all this if we go solo. This is why we work with the different partners to support the work that we are doing or implementing in India. And one of such partner is Julius Baer Foundation, JBF, which is supporting our work in India, more especially supporting adolescents that are living with HIV to ensure that they have long-term health outcomes, but also at the same time, we need to create that opportunity, socioeconomic opportunities for these adolescents that are living with HIV. But for us to attain this, we're looking into two thematic areas. The first one is now to ensure that we are improving access to quality HIV services through the decentralized services that we are providing in Ineno. The second thing is also ensuring that we are creating that opportunity for a socioeconomic opportunity for the adolescents that are living with HIV, so that at the end they should be self-reliant and improve their economic pathway. But to do this again, there are also several interventions that we focusing on or we are doing. And the first thing that we did was to ensure that we understand the socio-economic profile of these adolescents that are living with HIV, and so that it should also guide us to do better programming of our services. So we carried out an assessment, and then at the same time, this assessment also helped us to the program. So at the same time, this assessment, the findings helped us also to redesign the HIV teen club delivery and implementation approach. And through that, we revised HIV curriculum. We came up with a new HIV curriculum that also incorporated aspect of mental health screening and linkages to care. We also included the issues of sexual reproductive health and also included issues of career guidance for the adolescents that are graduating from the HIV teen clubs. And again, we also scaled up and decentralized the HIV treatment care in all the facilities in the district. They are able to provide HIV teen club services. So that's on HIV care. But also on socioeconomic, there are also several aspects there that we are focusing on. That's including provision of supporting vocational professional trainings and entrepreneurship skills for adolescents that are living with HIV, and also supporting them in their families with other sustainable income generating activities like provision of good seed programs or livestock production programs.
Wonderful, wonderful, Jimmy. I know you have stories for us, no, related to these programs. I know you have, it's not only a process, but there are lives of people that are, involved in this. And I know that the vocational training aspect of this project is quite important. Can you give us a story, a case of somebody?
No, thank you so much. Like I mentioned, several adolescents have graduated from our vocational trainings. That's plumbing, motor vehicle mechanics, motorcycle mechanics, and computer lessons, and many more. But I think here, one story that I can share is the story of Patrick Francis. Patrick was a school dropout and had no hope. But through this program, Patrick was supported the vocational skills and he got the startup equipment. And this is what Patrick had to say. Through the skills, the training skills that I got from partners in health, Abwezi Zaumoyo, I'm able to support my family, my granny, and I even managed to procure 15 bags of maize that I will sell later. My aim is to buy a motorcycle that will help me to go to Mwanza to and from, where I buy materials for my tailoring to sustain my life and my family. So that's what Patrick had to say.
Thank you. Thank you, Jimmy. That's a really great, interesting story related to the vocational training program that he took and how that allowed him to acquire both the skills and the opportunities for him to continue his work. But I know that the program also includes a very important component of education. Can you give us also maybe another story, another idea of how you are changing the lives of those young people in Nino, please?
All right, thank you. Through our education program, we are supporting adolescents in secondary school, universities, and colleges. And that's also including medical education. And one of the adolescents, Grace, is supported on medical education. And this is what Grace had to say. Through the support, the bursary education bursary that I'm getting from partners in health is going to help me to achieve my goal of becoming a clinical officer. And this will be able to assist me to help my community at the same time also helping my family and uplifting the livelihood of my family. So this is also what Grace had to say, attesting to the support that we are providing to adolescents.
Thank you, Jimmy. Thank you very much. You know, this is very difficult to unpack all this in such a small amount of time, and you've done great in giving us a very good overview of the work that APSU does. I invite all of you that are listening to write your questions using the chat function, and I will see those questions. Actually, there are a couple of already happening. I'll see them, and then I'll pass them on to Jimmy. So Jimmy, I've also taken a few notes, and before I share with you the questions that I've seen here on the chat, I wanted to throw back at you some of the points that you've mentioned. First of all, that you mentioned that APSU is working in Malawi and in the Neno district for quite a long time now, almost 20 years, no? So since 2007. And that you are not addressing just a few people. You're supporting, you know, the health care of about 160,000 people. You've mentioned that the question of HIV amongst adolescents is still a problem. And you've addressed this doing two things, which is interesting. Not only you look at the health issue and access to quality decentralized health in a very remote regions, but you also wanting to create more socio-economic opportunities for those young people. You've mentioned something related to, and the program that you have is quite comprehensive, but I'd like for those of us who do not understand or know what is a teen club or the curriculum of a teen club, can you give us a sense of what it is, please, first?
Okay, thank you, Natalie. HIV Teen Club, this is the curriculum. This is a guide that helps the service provider, the mentors, to provide the appropriate, care to the teen or adolescent that are accessing the services through the teen clubs. So one thing that we did, like I mentioned, that we had to review the curriculum. There were some gaps that we identified in the previous curriculum, and then we had to revise it. So some of the gaps that we identified during that time in the previous curriculum is what we thought we need also to address that. So this is why I was mentioning to say we included aspect of mental health because this is also one of the key challenges that was there. But apart from that, the Teen Club curriculum also focuses on issues of positive living, issues of drug adherence, and all these other social components that we thought is also important to be included in this. And also for us, we thought it was important also to incorporate the socio-economic aspect, as I mentioned, because we cannot talk about providing quality care without including this.
Very, very important. And here, Jimmy, there's already 2 questions that just came up. The first question is, in terms of the HIV issues, do you see challenges that are specific to Malawi compared to other African countries? And if so, which are those challenges? And so first of all, let me start with these questions. So in terms of HIV issues, do you see challenges that are specific to Malawi compared to other African countries?
Yes, thank you. Yes, we have these issues. I think as far as HIV is concerned, I was just talking about the HIV teens. You could find out that there are also these issues that I talked about, the socioeconomic issues that are affecting us, affecting our adolescents, even affecting people, like one that the poverty. People are not able sometimes to access the quality of services. People are walking long distances to access quality care, even the medicines. So that is also a challenge. Sometimes because of this, the poverty, people are not able even to get active, adequate nutrition support. So these are some of the challenges. In terms of even medical supplies, like those that are on treatment, they need also regularly, we need also to check the viral load to ensure that the treatment that they're getting is really working. So sometimes there's also these issues, challenges in terms of medical supply, and this is why we are coming in to support some, to fill some of these gaps.
Thank you, Jimmy. There's many questions are coming, but I know it's always the problem that we're pressed with time. Let me just take one question here. Jimmy, we have had comments from people saying that this is an important topic and how can APSU share also its learning in other parts of Africa? And there is a question my question is challenges you are experiencing with older adolescents going through this program. Are there any specific challenges that you see with older adolescents? And mind you, Jimmy, we have 1 minute left almost. So very short answer before we conclude.
Yeah, thank you so much. There are a lot of challenges. And one of the challenges where we're operating, I think there are also a lot of challenge in terms of education attainment. So that's one challenge. Most of the adolescents, I think their education, they've dropped out of school. So we need also to address that. There are also challenges. I think poverty is the major issue affecting the adolescents. And they don't have guidance in terms of their skills and the career guidance. So this socioeconomic aspect is also one of the biggest challenge that's affecting adolescents in Malawi and across, but also issues of HIV and the sexual or reproductive health impact, like the ones that I mentioned, the teenager pregnancies, the HIV, the STIs. So these are also some of the issues that need to be addressed. Thank you.
Thanks a lot. As I said, many questions and very little time, but I would like to thank you very much for your participation. Jimmy, first of all, thank you for giving us your time and giving us some great insight on on the work that you do. And I hope this event has been interesting to you. Please join us at our next live event, July 1st. On this occasion, we'll have the opportunity to talk about education inequality. You will see a QR code now on your screen. Please scan it. Please subscribe to our work and visit our Wealth Inequality website where you can sign in. And thank you very much. Goodbye to you, boy. Bye-bye.